Welcome to the Alcohol and Drug Awareness Toolbox talk. We have a zero-tolerance policy for alcohol and illicit drug use in the workplace. Everyone has a responsibility to perform their duties without being under the influence of alcohol or drugs. All personnel, contractors and visitors are required to follow the company's alcohol and drug policy. Section 1. Alcohol and drugs. The use of alcohol and drugs can impact on workplaces in a number of ways, including affecting relationships, safety and productivity. All staff, contractors and visitors must be free from alcohol and drugs, comply with testing requirements, and report to your supervisor any prescribed and/or non-prescribed medication you are taking. Risk to yourself or others due to the effects of alcohol or drugs, or suspicion of others in the workplace who may be under the influence of alcohol or drugs. As an employer, we have a responsibility to educate employees about the effects of alcohol and drugs on health and well-being. Advise employees during induction that alcohol and drug testing can take place on site. Offer support and assistance to employees experiencing alcohol and drug problems. And keep all testing data and personal information confidential. Here is a list of different alcohol and drug types. Click the buttons to learn more. Alcohol and drugs can affect your ability to remain awake, remain alert, react in a timely manner, make good judgment calls, or function normally, physically. Having a hangover, or coming down from drugs, at work can be just as problematic as being intoxicated. Headaches, blurred vision, irritability, problems concentrating, lost voice and extreme tiredness can all create an unsafe and unproductive workplace for you and your co-workers. Symptoms of alcohol and drugs are similar to fatigue. Erratic, abnormal or unusual behavior, increased rate of near misses or incidents, and deteriorating work performance. There is always a level of risk when using any drug, including prescription or over-the-counter medications. All staff, contractors and visitors must notify the supervisor or manager if they are taking prescribed or non-prescribed medication. It's important to follow your doctor's advice when taking prescription drugs and to discuss how any side effects might impact on your work. Section 2. Alcohol and drugs testing. Click on each button to find out about alcohol and drugs testing methods. We have a zero-tolerance policy for alcohol and illicit drug use in the workplace. All employees, contractors and visitors must have a 0% breath alcohol concentration and a confirmed negative drug test result. If a negative result for the presence of alcohol or drugs is recorded, the worker may enter site and start work. Any employees, contractors or visitors found to be in breach of the alcohol and drug policy will be removed from site. A negative sample will be required prior to being able to return to site. An employee assistance program may be available to help workers with personal problems to access specialist counseling services. An EAP is a private and confidential service between the employee and the EAP provider. Be proactive in assisting to solve health and safety issues in the workplace and support others to do the same. Individuals who seek assistance will not be disadvantaged and all employment rights are safeguarded. There will now be a short quiz to test your understanding of this module. We have a zero tolerance for alcohol and illicit drug use in the workplace. If you are taking prescribed or non-prescribed medication, you must advise your supervisor. Testing for alcohol and drugs can occur. The highest allowed blood alcohol limit on site is. The use of alcohol, illicit drugs and some medication can affect your ability to. There will be no repercussions for employees who refuse to undergo testing for alcohol and drugs.